Well, let's welcome Dr. Travis Gratton with University Veterinary Care Center. In today's pet advice, we're talking about vaccine titers. What are they?
Well, we've heard a lot lately about antibody tests in the news.
Yes, we have.
And vaccine titers are essentially an antibody test. We take a little bit of blood from the patient. You can then determine what level of antibodies a particular patient may have to any particular disease. And for some diseases, that level is indicative of immunity.
And when would they be used?
Well, a lot of times we're using them to determine, do we need to vaccinate that particular animal for that disease? And the trend of vaccinating based upon risk and not just blanketly vaccinating every animal for every available disease is kind of picked up. Certainly some individuals who are elderly, have other health problems go on, those who have had prior reactions to vaccines, which you covered some of those with my partner, and you know, just the general trend of wanting to spread vaccinations out.
Now, is there any harm for an animal getting a vaccine maybe more than once if somebody doesn't do the vaccine titer to find out if they've already had it?
Very little harm to actually doing it, or repeating a vaccination, and it kind of becomes the balance between wanting to know, do they really need it, and the price difference between the vaccine and the testing, which is usually going to be more expensive, although has gotten much more reasonable in the last few years.
Well, what are some of the diseases that can be titered?
Well, certainly the big ones, rabies. There's good science that correlation of antibody levels and protection against exposure to rabies is excellent. Canine distemper, parvovirus, and hepatitis or adenovirus are the ones for dogs. Panleukopenia, which is also an intestinal parvovirus in cats, are all very well established. A little less protective are levels of antibodies to the respiratory infections in cats. So.
Well, are there any diseases that can't be titered? Well,
certainly the respiratory infections in dogs like Bordetella and canine influenza just don't correlate to protection. Leptospirosis in dogs would be another one that doesn't, or feline leukemia in cats. Those are more the cell-mediated immunity. We hear about the T-cell reactions here with the coronavirus, and it's that balance between which animal or which diseases are controlled predominantly by the cellular side with T cells and other white blood cells, and which are controlled by the antibody side, which is what titers determine.
Okay, well, Dr. Gratton, thank you for being with us today and explaining all this to us. And if you'd like more information about University Veterinary Care Center, head over to universityvetcare.com.